Hi, I'm Henry Camp. I've learned some things recently about health that I'd like to pass on to you. I think there was something that you may want to think about and perhaps do something about. First, I want to introduce Fred Kaufman. And he asked this question: what makes the apple fall? I can hear you saying it now. Yep, gravity makes the apple fall. Interesting. Then, if that's true, then this is a miracle. Why? Because there's gravity and the apple doesn't fall. There's a second truth, and the second truth is I have to let go of the apple for it to fall. And this is true. There are two vectors, Fred says, in everything that happens. The one that's in your control and the one that's out of your control. And then he asks, which one do you choose? I'm going to come back to this point at the end of the presentation. Here's a chart. It shows annual deaths per 100,000 Americans over time. In fact, it's about my lifetime. But oops, you can see there's been a regression in the improvement here at the end. So the question is this increase a random fluctuation like we experienced in the 80s? Or is there some cause, some specific cause? I arranged here the list of the major killers of the United States population, and there's something that they have in common. At least all but one of them have in common. They are lifestyle diseases. If this is true, it means that 9 out of 10 people kill themselves. Now, I ask, how will we know? Well, I think we only have to answer one question, and that question is, are healthcare costs spiraling out of control? And they are. Is it because doctors charge 10 times as much as they charged before? Hospitals charge 20 times as much as they charged before? No, that can't explain the increase in healthcare. The increase in healthcare is driven by people getting sick more than they were before. So let's talk a little more about the medical community. And first, before I go on, let me say that those people who take care of us when we're sick are our friends, and we must thank them for what they're doing. They're not the problem here. But the healthcare community has three parts: hospitals, drug companies, and the docs and nurses. Again, more and more people are sick. Here's the proof of it. You know it. Common sense. And Obamacare has caused a problem. For some doctors, many are dropping out of the system. Some are concierge practices now, which means they see far fewer people. So the remaining doctors are overloaded. Drug companies and hospitals want to make more money. I think that's a given. And even if the docs and nurses are on your side, they're just too busy. It's also true that there's an incentive, a financial incentive, that the system probably charges 1,000 to 1 for curing a disease rather than avoiding a disease. So my question is, will the medical community really look out for you? I claim the odds are stacked against you. And let's talk about how people get sick in the first place, because lots of us try to get some exercise. A fellow named Joe Dillon presented me with this pie chart, and he claims 75% of your health is driven by what you eat. And Joe should know, this is a guy that trained Olympic athletes to get that last 2 or 3% that they needed to get Olympic gold. These days, we're too busy to stay fit with exercise only. In the old days, maybe when we had to carry water and chop wood, perhaps we could get enough exercise. But now, sitting behind desks and staying most of the day inside, it's very, very difficult. And exercise is only 20% of the factor that determines your health. So fitness mainly relies on what we choose to eat. But who educates us about what to eat? Well, we've got the food companies, the government, diet industry, and of course our parents. Let's take them one at a time and find out, should we even trust them? Well, here's something that looks healthy to me. But look at this. This is just the first naked product that I saw. It says no sugar added, yet there are over 16 teaspoons worth of sugar in this one 16-ounce, not quite 16-ounce drink. That's amazing. It's an extraordinary amount of sugar. In the old days, our parents and grandparents, they were having maybe 4-5 teaspoons a day. Now, 16 in one drink that you could have for lunch or for breakfast. And you might feed it to your children, thinking you were doing them a favor and giving them something nice and healthy. So the question is, should we trust what they say? If there's that much sugar in there, I ran across this interesting documentary called That Sugar Film. It was very interesting. This Aussie actor ate only advertised healthy foods for 2 months. Now, what he was trying to do by eating these foods is consume the amount of sugar that's in the average Australian diet, which was about 40 teaspoons of sugar a day. However, he only chose healthy foods. He gained 15 pounds, added 4 inches to his waist, developed prediabetes, heart problems, non-alcoholic fatty liver disease that the doctor was just amazed that he could have developed in such a short amount of time because his previous diet really excluded sugar altogether. And he had mood and energy swings. There's a nice clip down at the bottom. If you click on that, you'll see an interview where they go over some of the points in the film. Very interesting, only a couple minutes long. So maybe we shouldn't trust the messaging that we're seeing. Well, how about our government? They're there to look out for us. And here's the original USDA food pyramid. It was developed after World War II when we were worried about a population explosion and not having enough money to feed everybody. So the government officials, these are our elected officials, they don't have any particular expertise. That's not why we elected them. So they listened to the people who were doing the research, and the people who did the research were the people who were in the business, the agricultural lobby, and suggested what we could afford. Current research shows that cocaine and heroin are not quite as addictive as Oreos, and that's because of the sugar in the Oreos. Let's take a look at which parts of this food pyramid people are getting a growing intolerance to. So it's glutens, dairies, sugars, and as you can see, I've circled the areas of the food pyramid that are perhaps questionable for our health, and yet these areas dominate the government's recommendation to us. What about the diet industry? $20 billion spent a year, 108 million people in the U.S. on diets, 85% female. There are only 320 or so million people in the whole country. Therefore, there's more than a third of us on a diet at any given time. And if you stayed skinny, the diet industry would, of course, go broke. The problem would be cured. But we have this kind of vicious cycle. Here's Valerie Bertinelli, who loses 30 pounds, eats the Nestle, gets the weight back, and goes back to Jenny Craig, spends some more money, and there's a profit cycle for everybody, both the diet industry and the food industry. Now, what about your parents? Well, of course, we know they don't know anything. But seriously, it's not our parents' world anymore. That's the real takeaway message. Something has changed. Now, what is it? Well, it's hard to say what's changed, but let's throw out a working hypothesis. Let's say our food is what's changed. We now have GMO crops. These organisms modified genetically to get higher yields and so forth. And the main thing that GMO crops do, like corn, is they're resistant to glyphosate. Glyphosate's the major ingredient in Roundup, which is the number one weed control mechanism we have in our country. So we spray glyphosate over top of these plants. Once they've gotten up, it keeps the weeds down until the plants can get big enough to shade out the weeds. This gets higher yields for farmers, and farmers, heaven knows, need higher yields. They're struggling to make an honest living in the farming business, and so this is something that is really important to them. They need every angle they can get, and they get a tiny fraction of what you actually have to pay for food. I've superimposed a new graph over top of here that tracks glyphosate usage in tons on soy and corn with the bar chart, which shows deaths per 100,000 people due to senile dementia like Alzheimer's. Now, this is correlation only. It's not necessarily a cause, and there's no proof yet. But as we look at another chart, here's one about the prevalence of diabetes in the U.S., In this case, we not only have glyphosate tracked in the red line, but also a blue line which shows the percentage of genetically enhanced soy and corn crops that we have in the United States. And look how well it tracks. Again, correlation only at this point, no proof. My question is, are you willing to take a chance? And that's not all. Food changes may also be causing the vast increase in autism that we've seen just this century. Here's another chart that shows allergies, and another chart that shows asthma in children. And ADHD is also on the rise. You see that the chart starts off at 19,000 in 2003, up to 64,000 by 2009. And I don't even have more current data. The worry is it's going up even faster than this. So this is a major issue for us. Clearly something's changed. My hypothesis, my working hypothesis, is that it is our food. Certainly something in our environment, because genetics just don't change that fast. So who can you trust? Well, my bias is that people are good. I trust people more than I trust institutions. Why? Because people understand win-win. They need to belong. And perhaps that's why they understand win-win. Whereas on the other hand, institutions have goals that make me suspect of their motives. How would we know a good solution if we saw one? Well, first we'd be feeling better. It'd be easier than what we do now, which fits in with our difficult, busy worlds that we have. Support would be readily available and perhaps even free. We'd understand why it works so that we could help communicate it to others, family, friends, etc. And it would keep more money in our pockets. So let's get back to Fred Kaufman again and his little apple. It drops because of gravity, or it drops because I let it go? Interesting. Here's what Fred says about it. Why would anybody be so stupid as to choose an explanation that disempowers them? It sounds ridiculous, no? Of course, Fred's Argentine. That's his accent. And his quote. So the point I want to make to you here is that you can make a difference. There are many things out of your control, the vector that's pointing in the direction you can't control. But yet there are many things that are vectors that are in your control. And what I urge you to do is look out for yourself. This is the oxygen mask on you before you help your children. And we should also help each other. Take action. Thanks for your attention.